Support for Radio Friends comes from La Brunerie Financial, where they work to ensure a lifetime of financial security for people from all walks of life, from investment services to retirement plans. If you're looking for a trustworthy company that has the experience and knowledge to put your interests first, contact La Brunerie Financial, a community-based investment counseling firm since 1966. Good morning and welcome to Radio Friends on Monday, February the 21st. We're going to talk about good dental health today. And you know, February is National Children's Dental Health Month. And we have an expert with us today, obviously, Dr. Philip Batson from Columbia Healthy Smiles. Now, Dr. Elizabeth Abe, your wife, is missing in the other chair. Why?
She is pregnant right now, and very pregnant. Baby could come kind of at any time right now. So just for her sake and comfort, she is taking this talk off.
Got it. So this really fits in, National Children's Dental Health Month fits in with you since you're adding another child to the Batson family.
Absolutely, another mouth to feed, but also, once it grows up a little bit, some more teeth. We have a toddler right now, and so we're working to keep his teeth nice and clean and healthy every day as well.
Yeah. So let's talk about that. This being National Children's Dental Health Month, some folks may be listening and they've got kids that are a couple of months old, maybe a year old. What do you do? What do you do to start off on the right foot? Now, when you got the baby teeth before the adult teeth come in, is it as important to take care of those baby teeth even though they're not permanent?
Absolutely. So those baby teeth really provide, that first initiation into oral health, taking care of teeth. Eventually they will be lost, but what we try to tell parents when we talk about that is these teeth, some of these teeth have to stay, we want them to stay in until the kid is 12 years old about. And so if the child loses that tooth really early on, it can create spacing issues for when the adult teeth do develop and come in. And it can create, chewing issues, if the child's missing those teeth for an extended period of time. So what those baby teeth do, they really help hold space and hold that arch form for the adult teeth as they come in.
Is there ever a time, or is it common to fill cavities in baby teeth? In the original teeth?
Yeah. So in the children's teeth, if they do get cavities, it's better to be proactive with them. Baby or our primary teeth, as we call them, the enamel on them is not as thick, not as robust as our adult teeth. So cavities can spread in children's and the primary baby teeth quicker oftentimes than they can in our adult teeth. So it's better to be proactive on it. And if it needs hopefully just a small filling, sometimes they need treatment. But anything we can do to not let decay progress is important.
So what do you recommend then that kids before they're 12 years old, how do you recommend taking care of their teeth? Is it important to floss too?
Yes. So once if what we tell parents, watch as they're developing. Once you can't see spacing between the teeth, so kids' teeth, baby teeth have spacing in them a lot, which is great because primary baby teeth are smaller than our adult teeth, so we need that spacing there. But we do want to see flossing take place once those spaces close, once you can't see between the teeth, again, just like you would your adult teeth. And then we recommend parents, as soon as they start getting some teeth coming in, you just start washing it off with a wet washcloth after feeding. As they get a little bit older, you can introduce those children's toothbrushes up until, and then we use a power spin brush on our toddler to brush his teeth and help him with it.
You mean an electric toothbrush?
An electric toothbrush, yeah. We use an electric toothbrush on our toddler to help him. And, we just, it's that constant kind of just oral care, get the kid used to taking care of their teeth and make brushing just a daily routine for them.
Yeah. Do you find that if the kids start a routine like that early, that it carries through their adult life?
It really does. It's just that power of habit and routine. And also it makes them a little more comfortable when we start to see them at the dental office too, because they've had, this work done in their mouth or used to having, and something that kind of buzzes around in their mouth, when they get a cleaning at the dental office. And we encourage parents, to bring their children in starting around age 1.5.
That's what I was going to ask you. What is the earliest that you recommend that a kid go to the dentist?
So the recommendation, and it's from the Academy of Pediatric Dentistry, which we follow, they recommend 6 months after the eruption of their first primary tooth or around age 1. So whichever kind of comes first in that regards. Most kids will get their first baby or primary teeth around age 6 months. So that's what makes about a year a good time to bring them in. And a lot of times those first visits are we are checking development. We are looking to see if there's any problems coming potentially down the line. But it's a time for us to talk with the parents, give some home education for home care, talk about diet, talk about, what can be done at home for routine, and just begin to introduce that child to what a dental office is like, what's going to be at visits, and it just makes them more comfortable with the experience, and it's a part of the routine again as they get older for their just self-care.
So what's the biggest difference then that a kid, once all of their adult teeth are in, the biggest change that they need to make from before the adult teeth?
Remembering that this is the only set of teeth they will ever get. There's no replacements of these teeth, of your permanent teeth, as we call them, because that's why just self-care, taking care of them, is very important, so that we don't, the longer you can ever go without having to do treatment on tooth extends the life of that tooth even longer.
So those teeth, those adult teeth, they're going to have to last 80, 90, 100 years.
And then also part of this month, the American Dental Association is also talking about sealants for adult teeth in children. So children will start getting their adult molars around age 6. We call them the 6-year-old molars, the 12-year-old molars, and then wisdom teeth are the 18-year-old molars. But those first molars around age 6, age 7, sealants placed on them can help prevent cavities by about 80%.
So what is a sealant?
A sealant is just a tooth-colored resin covering that goes over the deep pits and grooves of the teeth where it's maybe harder for the child to clean, and it keeps the bacteria and sugars out of there as that child's developing until their home care can maybe be a little more consistent and better.
Well, do you put sealants on adult teeth too?
You can. It's not as common and is not as highly recommended. It's really recommended when that adult tooth first erupts into the mouth before it's had time to be contaminated, let's say, with everything in the mouth.
Okay. So when the adult teeth in the child first come out, it's important to seal them
if it's looking necessary from the exam. Yeah. But they can play a great role in preventing cavities.
I learned a lot today. If you want more information on any of this, you can give Dr. Philip Batson a call at Columbia Healthy Smiles, and your phone number is?
It's 573-875-7071.
Okay, and like you said, those teeth that come in once they erupt into your, I hadn't heard that term before, the eruption of your adult teeth, once they erupt into your mouth, they're there for the rest of your life, so take good care of them. Philip, thank you so much for coming by, and tell Elizabeth we send her our aloha, and hopefully the next time or two, maybe you'll bring the new baby along with you.
Absolutely. All right. Healthy baby, healthy mom.
All right. Something you'd like to hear or see, we'd love to hear from you. Pepper P, Missouri.edu. Have yourself a nice day.